As is the case in many communities in Canada, the homeless situation in Owen Sound and in the surrounding region of Grey County has become more dire in recent years. Many of the people who are the most vulnerable, who need the most help, turn to a very special agency that is literally one street over from where we are this morning. It provides meals, medical care, many other supports. And Linda has been sharing the story of OSHaRE, really the stories, because it's involved in so many aspects of social services.
Absolutely. We've been talking about what a multifaceted approach this is, and they are doing so much for the community when it comes to giving out food, when it comes to connecting people with a doctor. But I want to tell you about the SOS program that they run there. So 3 days a week, people can come in. We're lining up outside the door, actually, to come in and visit with a nurse practitioner, a mental health worker, somebody from the United Way who is called a social navigator who connects people with different services. It's sort of a one-stop shop for people who need help in this community. And I met a man, his name is Ed, and I want to just take you through his visit. Here's how that went.
Good morning.
How are you?
All right, how are you?
Good. How can we help you today?
Just typical concerns, you know, my mental stability, but as far as my addictions, my past 2 tests have come back positive, so that's good. My life was going downhill very quick, and I did not like the person I was, and I didn't know how to get away from that. The SOS group, they're just amazing. Like, I wouldn't know life without them, you know.
So the folks that we serve typically don't have access to things like telephones, clocks, alarms, and often can't access traditional services on the schedule that the system usually expects. So we've offered team-based care. So sometimes you might be able to have 3, 4, 5 of your needs met in a single visit because the whole team is here.
I've been dealing with the girls now from SOS for probably 18 months now, so I think I've come a long way. I'm able to look at myself in the mirror now and be proud of who I am. As I wake up in the morning, I actually have a smile on my face when I'm brushing my hair, you know. And like I said it before, and I'll say it again, if it wasn't for you guys, I wouldn't be here now. You know, I'd be in a box somewhere.
We're so happy to help.
I'm glad that the help was there.
He credits this program with saving his life. He was on the streets for 17 months, and now he has a home. He has all the service. He's made a real relationship with people here. And I also spoke with Bright Shore's Director of Mental Health and Addiction Services, who says it is actually life-saving because they've actually seen the number of opioid overdoses and deaths go down since this program expanded.
Very powerful, and thank you to him for sharing his story so candidly. This is a program, I mean, people in Owen Sound are rightly, justifiably very proud of OSHaRE, and other municipalities are looking to the kinds of things it does to use and implement elsewhere in the country.
Yeah, that's right. They even went to Ottawa to share some of their model. And part of that includes even a mobile drug testing, sort of a program where they go out and they'll actually drug test on the streets, the drugs themselves. So that is the first in Canada. They're now looking at possibly expanding that program. It started right here in Grey County, expanding that in some of the even bigger municipalities across Canada.
Fantastic, fantastic reporting all morning, and thank you for sharing those different aspects of OSHaRE.